Welcome back. October is Breast Cancer Awareness Month, and joining me now in studio is Dr. Kevin Morley with the UofL Health's Brown Cancer Center. Thanks for being here.
Thanks for having me.
And when should women start their screening mammograms?
So it's been shown that the greatest reduction in mortality from breast cancer, the most lives saved, is when women of average risk get their screening mammograms beginning every year at age 40.
And what are the benefits from undergoing annual screening mammograms?
So when patients get annual screening mammograms, the whole point of it is to catch breast cancer early. With early detection, you'll have a lower stage of breast cancer. And in theory, this will lead you to have less aggressive treatments, such as a smaller surgery, maybe a lumpectomy where they only remove a part of the breast versus a whole breast mastectomy, or even potentially not even having to undergo chemotherapy.
And what are abbreviated breast MRIs and who are they best suited for?
So let me just take a step back. Breast MRIs are a great tool to look for breast cancer. They find subtle cancers that are just sometimes difficult to find on mammograms. Traditionally, breast MRIs for the screening population have been reserved for high-risk patients, those with deemed 20% chance of developing breast cancer or higher. Now, there's patients that don't quite meet that threshold, that maybe they have a family member with breast cancer, they have dense fibroglandular tissue, and they want that extra level of screening, and that's where the abbreviated breast MRI comes in. At UofL, we offer this. It is a much shorter, truncated version of it. It's only about 6 minutes, but it kind of gives that extra sensitivity to supplement your mammogram to make sure you try to find any breast cancers that maybe are just difficult to see on the normal mammogram.
And when should patients undergo these screenings?
Well, every year beginning at 40, and then also we say that when you're younger at 25 or before, you talk to your doctor about getting a risk assessment. And what that entails is just to kind of see if you are one of these high-risk patients, because if you are, you will benefit from extra screening, maybe these MRIs, even the full protocol or the abbreviated protocol, or even an earlier or different kind of screening regimen.
Because we know, as we have seen on the news and also in our personal lives, like breast cancer does not discriminate against age.
No, it does not. Yes, I mean, unfortunately, it can affect people in their 20s. It's much lower incidence, but you know, by the average risk, you start at 40 now. Let's say you have a family member diagnosed at a young age, or you have some genetic predisposition. Talk to your doctor. You may qualify for earlier screening, but that's going to be person by person. For the average risk patient, really, again, 40, but every year, because that's your best bet to decrease your chance of dying from breast cancer.
And how have these screenings changed over time as technology's gotten better?
Yeah, it's significantly improved. We have what's, you've probably heard about 3D mammography or tomosynthesis. It just kind of reduces what we call false positives, meaning those, we call you back, we think there's something on, it turns out to be just normal tissue. It reduces that by simultaneously increasing the way we can find breast cancers hidden in dense tissue.
And this month is a good reminder for women to really look after themselves.
Yeah, it's just a great reminder to talk to your friends and family, to just get your screening and get in here and catch things before they, turn to a bad stage and you get better outcomes.
Good reminders. Thanks, Dr. Morley, for joining us.
Thanks for having me.
Well, coming up next at 4:30, new traffic cameras meant to help reduce speeding now rolling through